Hey, I'm Josh, and we're
Hi.
doing an abdominal exam today. Is that alright with you?
Mm-hmm.
Okay, so first of all, I'm just gonna do an overall inspection, looking for any visible lumps, any scars, changes in skin colors, hair patterns, anything like that. If there was a lump, I could have you turn your head and cough. If it persisted, that means that the lump would be intramural. If it went away, that would be an intra-abdominal. And so next I'm going to do auscultation. You always do auscultation first because if you palpate it will change the sounds you hear. So first I'm just going to start in the lower right quadrant with the diaphragm. Alright, everything sounds good there, so I'm going to use the bell now. I'm going to listen over the liver for any friction rubs. I don't hear anything. Now over the spleen. I don't hear any friction rubs there. So now I'm going to listen for bruits. I'm going to start over the aortic, which is about an inch above the umbilicus. And I don't hear anything there. Next I'm going to listen to the renal arteries. So that's about an inch up and an inch over from the umbilicus. Both of those sound good. Now I'm going to listen to the iliac, which is an inch down and an inch over from the umbilicus. Everything sounds good there. Now I need to do the femoral. Is it alright if I lift your shorts up?
Yeah.
Okay. Alright. Okay, that all sounds good to me. So that's it for auscultation. I'm going to be doing percussion now. So I'm first just going to start with the general percussion. Starting lateral, axillary line, then the mid-clavicular line, then midline, skipping the umbilicus, mid-clavicular line over here, anterior axillary. Alright, that all sounds good. Now I'm going to do percussion over the liver to try to find the borders, which should be no more than 12 centimeters. So, just going to start up above. Alright, here seems pretty decent size. So for the spleen, I'm going to have you lay on your side facing towards me. I'm going to take tissue slag and just palpate or percuss. That sounds fine to me. So you can go back on your back. So next I'm going to do percussion or palpation. So I'm going to start light. Since you're asymptomatic, I'm going to start in the right lower quadrant using small circular motions. Feeling for any lumps, any changes, anything out of the ordinary. And just work my way around. And that all feels normal. So now I'm going to do deep palpation. I don't know if there's any pain with any of this. Alright. So next I'm going to palpate McBurney's point, which is between the ASIS and the umbilicus. This is where you would have main symptoms with appendicitis. Any pain here?
No.
Okay. So next I'm going to find that aortic pulse, and I'm gonna find the width of it. So first I'm just gonna find the pulse, and I'm gonna measure the width, which should be no greater than 3 centimeters across. And yours seems fine. Next I'm going to I'm gonna palpate the spleen, and I'm gonna palpate the kidneys. So I'll start with the spleen. I'm gonna use one hand underneath and go up above and try to feel it in between my hands. I don't feel it, which is a good thing. So now I'm gonna go a little bit more medial and try to feel the kidney in between my hands. Same thing on this side. Normally you won't be able to feel those on people. So now I'm going to palpate the liver. So I'm going to have you take deep breaths, and I'm going to bring my fingers up underneath the rib cage. This is about the same area as Murphy's. If you feel any pain, or if you stopped breathing, that would be a sign that you had gallstones, right? And so now I'm going to do the rebound test. So I'm going to go just to a different quadrant from the right lower, and I'm going to push in and let go. Do you have any pain localized in the right lower quadrant? All right. And then for Rosving's test, I'm going to push in the left lower quadrant, same thing. Do you have any pain?
No.
All right. So now I'm going to do special tests. So I'm going to have you face away from me on your side. I'm going to stabilize your pelvis and have you extend your leg back as far as you can. Any pain with that?
No.
Okay. And you flip over on the other side. Alright, same thing. Okay, any pain with that?
No.
Have you lay on your back. I'm going to flex this knee up, and I'm going to internally and externally rotate it. Any pain?
No, sir.
Okay. I'll do the same thing on the other side. Any pain?
No.
Alright. That concludes our abdominal exam.
Thank you.